125 million people continue to be exposed to asbestos in the workplace.
So there's a big cost to humans using asbestos in dollars and lives.
Research that goes into these decisions has to be directed by independent, unconflicted scientists.
It's not something that just affects workers, it affects everyone.
Saving one life is great, but saving many more is what I hope to accomplish.
Making a profit off of people's pain and lives is wrong.
We can't quit, not as long as there are hundreds of thousands of people still to be diagnosed.
Ban the asbestos once and for all.
So just wanted to share with you a little bit about the organisation and why the subject of asbestos and occupational cancer is very close to our hearts and our vision for a safe and healthy world of work. IOSH is the world's largest professional occupational safety and health organisation. We're a professional body with over 47,000 members worldwide, operating in 130 countries, and who are all dedicated to ensuring that people go home from work safe and well. We have networks worldwide and we work across all industry sectors. We're a charity. We have a commercial arm that shares our training products and material through training organisations, and we have trained over 180,000 delegates each year in about 70 countries. We're a charity, we're a not-for-profit organisation, we are existing for public good, and we provide free tools and resources for businesses. Who doesn't like something free? And I'll mention that several times through my presentation. We do a lot of research with impact which informs our evidence-based practice, and we campaign on occupational cancer. We're an influencer of government and business, and we're a thought leader on safety and health. We're very proud of our association with ADAO, and we work closely with some other organisations that you'll be familiar with, the ASSP, the CSSE in Canada, and the Industrial Hygiene Society in America. So, our campaign, No Time to Lose. We are campaigning to tackle occupational cancer. We're here today to talk about how that is impacted on with asbestos. As I said, this campaign gives us a very strong bond with ADAO, and ADAO has been a very fantastic supporter to our fourth phase of the campaign on asbestos. And I'd like to thank Linda in particular for being such a strong supporter and working with us very closely over the last 12 months and more. When we launched No Time to Lose in 2014, figures showed that cancers caused by work were claiming at least 666,000 lives of people every year. Now, released in Singapore at the World Congress, more accurate figures are estimating that that figure is even higher. It's more like 750,000. Every year dying from work-related cancer. That's one person every minute. Cancer caused by work is the biggest killer in China, the Western Pacific, and Latin America, and also related to half the deaths in the European Union. The International Agency for Research on Cancer states that there are well over 50 substances that are known or probably causes of workplace cancer. And as we know, the biggest cause of occupational cancer is asbestos, claiming worldwide something in the region of 200,000 lives. The World Health Organization estimates that around 125 million people continue to be exposed to asbestos in the workplace. Occupational cancers can be prevented, so we need to continue to raise awareness and take on board stories like Julie's worldwide and tackle these causes together. So, the campaign aims, very simply, to raise awareness of a significant health issue facing employees. For far too long, occupational cancer had been under the radar, and it's our job as a global institution to work with others to raise the profile and campaign for control and prevention. Responsible businesses are doing a lot, but we need to concentrate on not only the big corporations, but small, medium enterprises, sole traders, small outfits who don't necessarily have the awareness or the resources, but are still very vulnerable. We offer businesses free, remember I kept saying free, practical, original materials. Let's not reinvent the wheel. We've got the evidence, we've got the research, we've done the work for people. We just want to get that campaign awareness out there to help people deliver effective prevention programmes. And the campaign aims to secure commitments from organisations to improve preventative measures. We ask people to publicly commit and make a commitment in front of their employees and peers to improve policy and practice, to influence their supply chains and influence customer choice. We believe everyone has a role in beating occupational cancer. As I've said, the campaign is 4 years old and it's been in 4 phases. The first phase was around diesel engine exhaust fumes, which we heard about in the keynote speech earlier before lunch. We're getting some traction with that now because of the debate on air quality and the massive prevalence of asthmatic conditions, particularly in young people. The second phase was solar radiation, aimed at outdoor workers, construction sites and agriculture in particular, and it was about simple steps to prevent solar radiation skin cancer. The third phase was about silica dust, and we focused on commitments from the quarrying industries, from construction, rail transportation and other industries to help us tackle silica dust. That campaign was so successful we won an industry award in the UK for the communications around it. And finally, we tackled asbestos. Our 4th phase was launched almost a year to the day in the Awareness Week last year. Campaigns like this take time to get going, but we've had some real success. And I won't read all of the things on there because I'm very worried about the timekeeper in front of me tackling me off the stage. But we have had really positive success with the campaign, reaching over 67 million people through our media coverage, 7 million people through our social media campaign. Our resources have been downloaded over 100,000 times, and we've had 334 organisations publicly commit to the campaign and 122 organisations who've signed up to our pledge. That's the launch in 2018. We launched the asbestos phase of No Time to Lose at the British Medical Association in London. We presented research there that showed worrying levels of ignorance among people working in construction trades, and we presented new materials to raise awareness of asbestos and how to manage it. In the run-up to the launch, ADAO collaborated with us to promote this and this phase of our campaign. And I think in just one day, we had 500,000 people access information on social media. So thank you. Linda has been very generous with her time, and she's worked with us in the UK, in Europe, in Africa, and in Southeast Asia, and we continue to grow the support. In terms of those free practical materials that I expect you all to have a look at when we finish this session, we provide those materials in all sorts of formats: fact sheets, posters, films, presentations, infographics, case studies. We know that you don't give a glossy A4 folder to somebody on a construction site. They want a credit card thing they stick in their pocket. They won't necessarily read literature, but they'll listen to a radio campaign. So we've tried to be very flexible about how we present our material, and we're starting to produce it in other languages. So I think there really is something in there for everyone. We've produced an 8-step guide to managing asbestos, which is about knowing where it is, recording where it is, undertaking a full risk assessment, a management plan, and informing people who are exposed, and more importantly, training workers on awareness. And obviously learning lessons from investigating those asbestos incidents. We've also produced a duty to manage asbestos flowchart, working with the UK's Asbestos Leadership Council, which represents government, enforcement bodies, professional bodies like us, trade unions and major companies. And the duty to manage guides is supported by all of the members of that group. So very quickly, how do you get involved? We've got over 320 supporters, as I've said, ranging from business to government to individuals to public bodies. Our supporters are offered support in campaigning to sharing our messages. What we ask is for you to sign up, make a few sentences, we'll produce that on our website, and you publicly commit to supporting the campaign. We'd also urge you to pledge to action. We've got 120 leading businesses who've gone that step further from a pledge to actually commit to doing something, being change agents. To do that, you need to assess the risks, you need to commit to deliver and develop a prevention plan, brief managers, engage the workforce, demand the same from your supply chain, and report progress. No time to lose in terms of the asbestos highlights. Again, I won't be happy until these sorts of numbers are in their millions. We have lots and lots of people to influence, and I want you to all go away from this session today being my advocates and my evangelists for this programme, because I think it definitely impacts on all of us. So we support the Awareness Week, take down the details in terms of where you'll get the resources and the material from, and I look forward to seeing you again next year.